New at 5:30, for people struggling with depression, the holidays can be a really difficult time of year.
Professionals with Grand Mental Health are working to help people overcome severe depression by using the drug ketamine.
Fox 23's Alexa Mostrom learned about this treatment, the possible side effects, and how it's impacting lives.
Ketamine is used as an anesthetic, horse tranquilizer, and was a well-known psychedelic drug in the 60s. In the early 2000s, studies showed the effect ketamine could have on people with treatment-resistant depression.
People who were stuck in their depression, people who've tried multiple medications and nothing worked, people who are struggling with history of trauma, whatever kind of trauma it was, and they're unable to progress in therapy. To get past that, we've seen significant improvement in those areas.
K. Michael Saliba, a psychiatrist with Grand Mental Health, uses ketamine to treat depression. In 2023, he opened this ketamine clinic.
We've had several patients who this changed their lives.
But there are risks.
When you give ketamine, which is kind of a psychedelic, you may hear voices, you may feel like you're floating. You may see things. People say, I see lights, or I see colors, or I feel like I'm, floating in the air.
Ketamine is an addictive drug, and there are side effects like nausea and hypertension. Every patient is carefully screened beforehand, monitored, and given very low doses.
The treatment is given under supervision. It is, we have nurses, Naomi is one of them, that monitor the patient. They check their blood pressure.
I asked Dr. Saliba how it directly counteracts depression.
When you look at a brain cell in a depressed patient, there's not as many connections to it. And after ketamine treatment, they looked at slices of brain cell, and what they found was there's a lot more connections.
The words sometimes like, I don't want to die, but I just wish I wouldn't wake up. And after my first few ketamine treatments, that went away.
Laura Moses has done ketamine treatment for a few years. She says it's changed her life and mindset for the better.
And I was a little concerned because when you go into the treatment environment before you do, all you know is that you're going to have a medication that could potentially change your perception of reality for a little while.
Moses gets treatments once a month. She recognizes that some people may want to abuse the drug, but she's never had a problem with it herself.
There is not a feeling of this that is a draw. There is a feeling of this that is a comfort that you go through, and afterwards there's no craving for it.
Moses says it's been very beneficial for her. She's happier and more social. She hopes it can help others as much as it's helped her. Covering news that matters, I'm Alexa Mostrom, Fox 23 News.
People who use ketamine treatments have to continue taking antidepressants and seeing their therapist regularly.
If you think you may be a candidate for this treatment, you can talk to your therapist or reach out to Grand Mental Health.
We do have more information on how to do that in this story on fox23.com.